Team 7, faculty, members, infusing mobile picture-in-picture ultrasound into musculoskeletal evaluation for healthcare students and professionals. Kellie, Bliven, Inder, Makin, and Ryan Hutman. Thank you, faculty members. Please, you have 10 minutes to make your pitch.
Okay.
Welcome, yay.
Good evening, class. This is a big crowd, my goodness. So I would suggest you all come closer and watch the show, okay? So we have over here today, we are going to do shoulder anatomy assessment with ultrasound imaging. And I'm sure you know everything about it. This is our candidate today, Dopey. And Dopey's been injured in the mosh pit, okay? So we're going to handle him today, and look very carefully on the screen. All right. So now we're going to scan this.
Hey, wait! I can't see where you're putting that probe.
Okay, just hold on.
How can I look at both of them at the same time?
All right. Now
it's too confusing.
This here. Now you rotate.
Hold on a second. You hold the probe there so I can see.
Okay. Okay. So do you not see the subscapularis over there when he rotates?
Well, yeah, I see the muscle, but I don't, how am I going to learn how to do it? If the transducer, I can't see.
All right. All right. Now, be patient, all right? So
I'm trying, but I'm just confused.
Okay. So this AV system does not seem to be working. What is
No,
going
it doesn't.
This must be the IT. I tell you. Where is IT?
Ryan!
Oh,
Ryan, come help!
Hey, guys.
Okay. So this is not working. What's going on over here?
I don't know. Have you tried clearing your cache?
Cash? No, I don't have no cash. It's end of the month, okay? All right.
Well, I got some ideas of something we could do. We could probably put the two images together to see them as one.
Oh, can you do that?
We can. We need some technology to do that. And what I'm suggesting today is that we would use a device called an AV bridge. It's made by Vadio. It would be able to take the video output of the ultrasound machine and turn that into a USB signal that a laptop can recognize as a webcam.
Oh my gosh.
With
How can you do that?
we would also use a second webcam to film the actual shoulder treatment in this demonstration. And then we would use some software, some free software to combine the two images on one screen, doing picture-in-picture all on one laptop.
Wow.
And it would look something like this. So this is a demonstration of the same kind of treatment that was done in using way, way more technology and money at a conference to do this.
That is perfect. I bet you could even put that online for me to study after class.
Okay. So, I have been in this area of ultrasound research for more than 20 years. And I will tell you that ultrasound imaging in medical healthcare, in healthcare, the fastest growing area is musculoskeletal imaging. And let me give you some examples of why it is relevant within our AT still scenario. So here is one of my colleagues, Lev Nazarian, published this a couple of years ago about the growth of ultrasound imaging in musculoskeletal as a function of various specialties. So here you can see all the specialties that you can care about really being represented here. And these are the sites where they are basically using musculoskeletal ultrasound. So this is a 10-year data, and these are number of scans they do in musculoskeletal. And you can see that the private office is where most of musculoskeletal ultrasound is done. That means these are not necessarily radiologists. These are an interprofessional team that is working with the patient while they're doing musculoskeletal ultrasound. So you would say, what does this mean? 800% increase of the number of scans done in the private clinic scenario over 10 years. Okay, 800%. I wish my pay scale would rise like that, but that's besides the point. Okay. Yes, that's great, but that is depreciated too. Now, here is by specialty. Look at the specialties over here that we're talking about. There are rheumatologists, primary care physicians, and these are color-coded, of course. And radiologists who already had their hook on musculoskeletal ultrasound have increased dramatically over 9 years, okay? And, but here is this community of physical medicine specialists. These are called podiatrists. These people have gone from 5,000 scans in 2000 right up to catching up with the radiologists. So what our point is that ultrasound is being used in physical medicine more and more. And just to give you a numeric number, here 225% increase in radiologists, but the interprofessional community of physical medicine practitioners rising by 1,500% over 10 years. So, having said that, what's the beef here? Where are the issues? Ultrasonography by another Chiang et al. Has shown that the operator, it's a very operator-dependent technique. So either you know how to use ultrasound or you do not know how to use ultrasound. If you want to learn how to use ultrasound, you need long training, especially in musculoskeletal imaging, where you're doing dynamic scans of the shoulder, knee, ankle, etc. So we are developing over here, proposing to develop a technique whereby we can build modules for ultrasound imaging with musculoskeletal applications.
Thank you, Dr. Makin. So the question really now is, how do we integrate ultrasound training into education in a meaningful way, right? So I have been co-teaching a throwing seminar class in the athletic training program for the past 8 years. And we're all familiar that baseball has increasing rates of injury from the youth through the professional levels. The good news about this is that many of them are preventable injuries. But in order to be effective in reducing these sport-related injuries, we really need an interprofessional collaborative team and innovative educational training. Both of these we have available at ATSU and can capitalize on. Two areas that we focus on in this course are the shoulder and elbow with respect to injury evaluation and prevention. So when we look at the shoulder, we usually are looking at shoulder motion and really rely on using this plastic goniometer to take our measurements. It's pretty limited. If we then look at how we can integrate musculoskeletal ultrasound into this assessment, we can have a much more accurate picture of what's happening and really enhance the information that the students are using to make their clinical decision skills for improved patient care. We also look at the elbow, and we use a hands-on clinical test to look at the amount of motion that's occurring at the elbow. But if we actually had ultrasound while we were doing that measurement, we could not only visualize the movement, but we could quantify it. And this would give us information about how well the ligament is actually working. So we are proposing to build a mobile picture-in-picture infrastructure. And the reason for this is it will allow us the capabilities of a enhanced live demonstration in the classroom, as well as creating online learning modules. This can be applied not only to the athletic training program, but to other ATSU programs and in the medical community. So what do we need? Well, you have a detailed itemized budget in our proposal, but in brief, we would like a webcam and tripod, necessary hardware and software, all of which will be housed and run on a high-performance laptop computer, all for the very low price of $3,850. So what will we do with this funding? We will build the mobile picture-in-picture software and integrate it with our currently existing ultrasound machines. We will then develop the learning modules, both for live and online delivery, which we will then integrate into the throwing seminar class in this upcoming quarter. And we will assess the effectiveness of our project by asking students' perceptions and also seeing what their ability is to use the ultrasound results in their building their competency-based skills. So in summary, this project is just poised to be the first of many that we can deliver within the ATSU community and within the medical community to enhance our ability for interprofessional collaboration for our patients. So I thank you for your time and consideration of our proposal, and we will take any questions.
Thank you, Kellie, Inder, and Ryan. Well done. Very well done. Judges, any questions, please? Dr. Gebbets.
Well, this seems like a wonderful possibility, as you say, for interprofessional education. Is there any thought to combining AT, OT, PT, osteopathic, and perhaps other students in the same kind of training module in order to look at what might be possible in terms of teaching them together?
Most certainly. I think that is a great idea. We were going to use this avenue of the throwing seminar class because it's hitting on these topics, but there's also a sports medicine club that includes all interested students. So when we do hold those courses, those individuals could be invited.
Great. Bob?
Seems like a great idea. How will you measure the effectiveness of whether this does improve the educational competency?
May I take a shot at it? So, yes, that's a great point. It's a nice-to-have tool. What does it do for the student and student education? So within musculoskeletal imaging, because of the rate of growth of this technique, there are established metrics for looking at shoulder. There are, in fact, European standards out there where how well you can image various structures, shoulder, knee, ankle, elbow, etc. So we will have those competency skills built into the teaching modules where we will see, okay, the student did this, did they even learn anything with that or not? Okay, so those are quantifiable, testing tools for competency, which will be built into the
Thank you.
Furthermore, I would say that within this particular course and others, not only is there the competency of actually doing the ultrasound as a technician, but we can create little vignettes and give clinical information to the students before and after they undergo the training to see how well they interpret and can assess injury risk in these people.
Right. Excellent. Ted?
How long is it going to take to produce your first module? And then, do you have a production schedule in mind?
So we have a 6-month, go ahead, Dr. Kelly. Go ahead. All right, so I'm just being polite. But
try not to fight over this.
Wait, all right, that's extraordinary.
We have a 6-month.
You need a mic.
I need a mic? Okay, so we have a 6 months plan that we have provided in the proposal. And the first will be acquiring the hardware, setting it up together, doing a couple of pilot runs in the lab with patients, with subjects, and then build the module, which Dr. Kelly is already thinking through as we speak. And then back to the previous question, this is interdisciplinary, if not interprofessional at least. Right off the bat, there are multiple specialties within schools, within AT still that we can leverage on building modules.
Awesome.
The course starts at the end of March.
There you go.
So it's a quick production, but it's feasible.
Beth, you had a quick question?
And the great presentation, thank you. My question always too is, and how does this add to the value of the student's education when they leave and they go job seeking? Is this a great thing to see on a resume?
Very good point. It is a great thing to see on a resume. A lot of these students are working in those private clinics as physician extenders, and your orthopedic clinicians are really integrating this into their clinical practice a lot. So while they may not be certified, if they have the technical skill along with the physician, they're working together and helping to see the patients better.
Great. Ted, you want a quick?
Yeah. Whose ultrasound machine are we using? Is it ours? Do we? Where do you get these?
Yes. So the strategic plan budget from 2015, 2016. Had basically allowed us to procure 3 ultrasound machines. Now, these are for interprofessional educational use, which are available right here. Those machines were specified by myself and with collaboration with others. PAs using them, ATs using them, and we are building these lectures and giving these lectures as we speak.
Fabulous. Great. Thank you very much. Inder, Kelly, and
Thank you for the
Ryan.
opportunity.
Thank you. Well done. Really well done. Thank you. Judges, please deliberate.